Man, I can't tell you the number of people that have asked me about managing blood sugars. That's right. They say, hey, I don't know what to do. I keep hearing one thing from one person and something else from another person. I see it on TV. I see it in a book. I got a magazine. My cousin told me. My auntie told me. Somebody told me something about blood sugars, and I'm confused. And what I want to do today is to give some elucidation. I want to make things a little clearer. We're going to be talking here today about an acronym that I use. It's called DAMSIC. DAMSIC, DAMSIC. And it really kind of puts the framework on the management of diabetes. And if you know, if you've been following me, you know my goal is to reverse diabetes. Hey, if you're new to me, I'm Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level. And in this year, new year, new you. I'm talking to adults with type 2 diabetes who want to reverse their diabetes, who want to get off of diabetes medications, who want to put their diabetes in remission, who want to improve their metabolic health. And that's what we do. If you're new, also go ahead and put new in the comments because we'd love to welcome you with a hand clap and some music. And let you know that we are happy that you're here. Go ahead also, if you have questions, put those in the comments and put a Q in front of them so we know that that's something that we need to get to as we get throughout the evening or get throughout the show. As you know how I do, I've got my monitors that we're going to take a look at right here. So I've got my Keto Mojo, I've got my Contour, I've got some test strips. Right down below you see my Dexcom Clarity Report, which we'll take a look at here in just a little while. And if you've not already done so, I want to make sure that you get over and look at our show where we talked about the second pillar of reversing diabetes. Remember, the pillars are decrease insulin, suppress appetite, and reduce sugar. And the last show that we did on our live was dealing with the second pillar, and that is the suppressing of the appetite. Well, let's get to our talk. Let's get to what we're talking about. So type 2 adults with type 2 diabetes. That's who I'm talking to. And I get the question all the time about what are the things that will affect my blood sugar? What are the things I should be concentrating on and paying attention to? Often I'll have someone come to the office and we'll begin talking, and I'll ask them the question, well, what makes your blood sugar high? And they say, I don't know. And we walk through the process, because if you don't understand the things that will make blood sugars go up, then it's difficult to address, fix, and improve those things. Remember, here we educate, we empower, and we encourage. And the big part of what we do in terms of being successful, it has to do with education. And so today we're going to spend some time going through and dealing with the education that is putting some things in your mind so that you begin understanding what are the things that will affect blood sugar. Before we do that, let's hop over and let's take a look at blood sugars. You see right there on the screen that my blood sugar right now is 95, and I have been, let's see, 24 plus 5, 24 plus 8. What's that? Huh? 24 plus 8. And you math folks that are out there. So 32, right? So I've been fasting for a little over 32 hours. Blood sugar right now 96 according to the Libre, and then according to Dexcom 108. As you know, the Libre, Dexcom, and all meters really can be different from each other, about 20%. And let's hop over and let's take a look at what my monitors are actually going to say. As you know, I have a Keto Mojo, which gives me a blood sugar and ketones. And then, of course, I have the Contour, which does blood sugar. So let's go ahead and take a look at that. Let's get a strip out, and we'll see what this is. The Contour. So we'll get a strip in there. If I can get it in, there we go. Get that in, and then we'll start with the blood sugar on the Keto Mojo, and then we'll come back to do the ketones in a minute. So what do you think my ketones are going to be? If you're out there, go ahead and drop in. What do you think my ketones are going to be after 32 hours of fasting? Okay, Let's grab that, and then let's get into our container here. We'll grab a couple of Lansing devices, and these are single-use lancets. You break off the top part here, and this one happens to be purple and white. They come in lots of different colors. Let's go ahead and pop that off, and then let's do this. I'm going to pull this up so you can actually see and hear. Hopefully I get a good... All right, let's see if that give us a good, not quite. So I think I'm gonna use a different finger, because I use the same finger all the time, and so sometimes that one's a little calloused, and so it may not be the best for a stick. So let's go ahead and do that again, and I'm gonna use a different finger this time, one that I don't normally use. And of course, a lot of you who are diabetics know that you tend to use the same one because it doesn't hurt. All right, let's see what that one gives. All right, there we go. So we got a good drop of blood. Let's go ahead and get that started. That's the Keto Mojo. And then, of course, the contour. And so the Keto Mojo says 103. The contour says, in just a minute, it says 99. Okay, so we've got, let's go back over. So we've got 96 with the Libre, 95 now, 99 with the contour, 103 with the Keto Mojo, and then 108 with the Dexcom. And so let's go ahead and switch over quickly so this blood doesn't dry here on my finger stick. If I can get this open. So we're going to get a ketone strip for the Keto Mojo, and then get that started. All right, so we'll see what that is. So what do you think it is? What do you think my ketones are going to be after 32 hours? And of course, as I do, I always tease you guys because I'm not going to show you what that is. I know. But we'll come back and we'll take a look at that here in just a little bit. Okay. But let's hop over and let's talk. Let's talk about our subject today. And so really what I want to do is put some framework to your concept of blood sugars, blood sugar management, and what are some things you should be thinking of, right? Here, I'm using fasting as one of the tools that works for the management of diabetes. But I want to spend some time talking about this acronym, and the acronym has evolved over time. So I've seen now thousands of patients over 20 years of treating patients. Okay, here in my practice, as I trained, as I was a medical student, going way back to when I started this whole process. And over those years, I've seen those patients and I've talked to people, and here in this space as you have interacted with me, and I've seen clients. And so there are a few things that kind of bubble up to the surface that are consistent across the board. And so over the years, this acronym that I came up with, it started out as one thing, and we've incorporated and done some stuff. We've done some refinement. And right now, the acronym is simply this. It's DAMSIC. D-A-M-S-I-C. D-A-M-S-I-C. So diet, activity, medication, sleep, inflammation, and cortisol effects. Okay, so we'll kind of walk through those. And each of these can actually be a segment, can be a show, can be an entire series on its own. We're going to spend some time kind of going through them briefly, and then later on we'll come back and we'll actually do a component, a module, where we'll dive into each of these separately. Okay, so DAMSIC, D-A-M-SIC, D-A-M-S-I-C, and that was my Keto Mojo meter just saying that, hey, we're good. Okay, so DAMSIC. So I'm going to spend some time walking through this acronym. And once again, these are the things that seem to bubble up to the top over years of seeing patients, over thousands of patients now, over treating people with metabolic disease and high blood pressure and cholesterol and, of course, diabetes. And we are in the process of working to improve all those metabolic diseases. And as you know, the prototypic metabolic disease is diabetes. So if we can get something that manages diabetes, then it affects all of those. And as I've said before, just because someone does not have diabetes does not mean that the process doesn't work, but it helps to understand how to begin thinking and talking about diabetes, so that when someone asks you a question, or as you're even thinking about what do I do for my management, then it's not clouded, because you have something you can kind of go through and talk, okay, how am I doing in this area, and this area, and that area, and this other area? And you can begin putting some structure to the management of your diabetes as we move in the direction of reversing, right? Because remember, that's what we're doing. We're reversing diabetes. So of course, the very first one that I want to talk about is diet. And diet is perhaps the I don't want to say the holy grail, but if we can manage diet, if we're able to do the things in our dietary habits that are in keeping with decreasing metabolic disease, then much of what we have to accomplish has been solved. You may have heard me say before, of all the things that I talk to people about, of all the tools and activities and the tricks and tips and hacks that we talk about, if I can get somebody to manage that plate, oh yeah, we are so much farther along in our process than we could ever be, right? So diet, very important. And when we talk about diet, perhaps the most important thing that I want people to begin thinking of is this idea called glycemic index. Now, I don't want you to go out and start looking at things and say, okay, what is the glycemic index? And I want this one versus that one. That's not the idea. But the glycemic index really puts into perspective the idea that foods affect our bodies differently. And in particular, when we talk about food, we're talking about carbohydrate as we deal with diabetes. Now, the proteins you'll see there, we talk about lean proteins and healthy fats and so forth. We'll get to those. But when we talk about the food that affects blood sugars, it is the carbohydrate that does that. If we can somehow deal with carbohydrates and get carbohydrates managed, then blood sugars improve. Remember, the issue with diabetes is really not a blood sugar issue. Blood sugar is a result. It is a symptom of the underlying problem. The underlying problem is a problem of insulin. So as we get foods that spike our blood sugar, then now our body has to respond, or we have to respond by taking medication to bring those blood sugars back down. And that medication, right, however good it is, has side effects. So that's the whole idea. So when we talk about glycemic index, I'm not necessarily wanting you to go out and find a chart that has glycemic index of one food versus another, which is actually a good thing, by the way. Right, but I want you to begin understanding that foods have different effects on blood sugar. And that is a very fundamental concept. And the things that will cause blood sugars to go up are those foods that contain carbohydrates. Foods that contain carbohydrates. And people will say to me, well, what are carbohydrates? Where do carbohydrates come from? And if I want to give you a rule, if it grows, if it comes out of the ground, then it has carbohydrates in it. And that is how we kind of come up with this glycemic index, right? So the things that have carbohydrates that are more readily absorbed by the body, they have a bigger spike or more rapid spike in the blood sugar, and so they have a higher glycemic index. And so the idea with glycemic index is to really find things that have lower glycemic index compared to others. So that if you are comparing, for example, starchy versus non-starchy vegetables. So starchy vegetables would be things like potatoes, right? That's a prototypic starchy vegetable. Or starchy foods, right? It would be rice or pasta. If we're comparing that to something else that we know has carbohydrates, like green leafy vegetables. We know that they both have carbohydrates because they both grow, all right? We said anything that grows, carbohydrates. but the potato has a higher glycemic index compared to the green leafy vegetables because it will cause a bigger spike in our blood sugar. Because when we eat that, the body breaks those carbohydrates down, and those carbohydrates cause a big spike. Now, as we talk about this, another issue to talk about, or not issue, but another concept, is that the more refined something is, let's take that same potato, right? Let's get rid of the fresh green leafy vegetables for a minute. If I take that same potato and I compare the potato in its natural form versus something that's processed, right? So take a potato and I eat it, whether it's natural or I now turn it into some potato chips. The potato chips now has a higher glycemic index compared to the potato in its natural form, because what's happened is we've taken the potato and we've processed it and we've made the carbohydrates in it more readily accessible, more readily absorbed in the body. And so now we get a bigger spike in blood sugar. So even within the same food, depending on how it's processed, it can cause a different response in the body in terms of blood sugar. Okay, so diet. So glycemic index, the idea that different foods affect the body in different ways. And in this case, we're talking specifically about carbohydrates. All right, we'll talk about fats and protein here in just a minute. All right, I hope that makes sense. And as we talk about continuing with a diet, lean protein and healthy fats. Why do lean protein and healthy fats help us? Because they decrease, right? They halt the absorption of carbohydrates, so that when you eat protein and you eat fats with carbohydrates, when you eat them together, your body doesn't absorb the carbohydrates as readily as if you ate it separately. So that if you ate, and I'm going to just use an example, right? You ate a steak and potatoes, then your body will absorb the potato, which is the carbohydrate. But if you eat it with the steak, it doesn't absorb it as quickly as if you just ate the potato by itself. Right? Potatoes and butter, right? Another example. You may not like that, but that's okay. But if you eat just the raw potato, then your body will absorb those carbohydrates readily. If you eat it with some butter, then it doesn't pull it in as quickly, right? So fats and protein help to blunt. They help to minimize the spike in blood sugar. The other thing that proteins will do is proteins will help you feel satiated longer and better. What that means, it will help you not feel as hungry. So if you ate that potato, and we keep going back, that we're picking on the potato. If you ate that potato and by itself, then your blood sugar will go up, a little spike, right? Your body will deal with it, hopefully. Blood sugar will come back down, but then you feel hungry again sooner. But if you ate it with that steak, right, or with the fat, well, let's deal with steak because we're talking about protein. Then you feel fuller longer compared to eating it by itself. Does that make sense? Okay. And when we talk about food, we want to talk about nutrient dense foods. What does that mean? Nutrient dense. There's a concept, or one of the concepts is nutrient dense versus calorie dense. Calorie dense foods are those foods that have high calories but don't give you a lot of nutrients, which makes sense, right? So nutrient dense versus calorie dense. So let's see, okay, so here's one. So a candy bar. A candy bar has a lot of calories. In fact, when I was growing up, you had to get a big candy bar to get the same number of calories. Now you can get a candy bar that's the size of, I don't know. Right, this is the container, or the little thing I took my strip out of. So let's go ahead and if you get something about that small, and I want you to compare it to this is what my finger looks like, right? As big as that is. You can get something that small that has, huge number of calories, but it doesn't have a lot of nutrients. And when we say nutrients, we're talking about vitamins, minerals, fiber, fluids, right? So all of those things are what we're talking about when we talk about nutrient dense. So you want to make sure that you're eating foods that are nutrient dense and not just foods that are calorie dense. Because if we don't do that, then we run into issues of we run into issues of weight, high spiking of our blood sugars, and then that itself causes other issues for us that we sometimes do not want to get into. And then, of course, here we're talking about metabolic disease, and those metabolic diseases begin causing or spiking. And so now we run into high blood pressure, high cholesterol, and all the other things that we see when we talk about metabolic disease. And so remember, what we're doing is we're talking about how do we improve blood sugars? How do we improve our lifestyle, in this case diet, so that it helps support us in the direction we want to go with respect to our disease process. Okay? All right. So once again, we're talking about our acronym, right? So damn sick. Damn sick is where we are. And so this acronym gives us all of the, well, not all of, but a majority of the things that we need to pay attention to as we are working through reversing our diabetes. Okay. And just another point to be made is that it is a progressive idea. Often we take someone or you and we expect them tomorrow to be completely 100% perfect in the process of improving their metabolism. And some people have been living, eating, behaving in a certain way for all their lives. They're 50, 60, 70, 80 years old, and they develop a disease. And yes, we want them to be expeditious in our improvement, but it is a process because it involves a lot of changes. Okay. All right. So diet, activity, medication, medication, sleep, inflammation, and cortisol effects. So damn sick. Okay. And so that was the diet. So let's talk now about activity. In activity, when I say activity, I don't mean joining a gym. I don't mean, going out and doing, high intensity training, although all those things are good. I simply mean being able to move. Get up, get out of the chair, get out of the house, and sometimes not even get out of the house. Just walk in the house, around the house. Use your muscles. That's what I mean. Use muscles. Okay? So activity. The higher intensity, the more frequent, the longer that you do it, the better it is in terms of activity, as long as you're not causing injury. But I don't need you to go join a gym. I don't need you to go out and buy, an entire gym and set it up at your house. All I need you to do is begin moving with intention. So why is activity important? Because activity improves insulin sensitivity. I love this, right? So when we talk about exercise and we talk about activity, and so let's use the word exercise. So muscles that are exercised, muscles that are working, muscles that have been trained, burn more calories, burn more sugars than muscles that are not. We said that insulin is the issue when it comes to diabetes, right? It is the culprit that results in high blood sugar. So high blood sugar is not the issue. It is just a result. So your body has to get the sugar into the cell. And with insulin resistance or hyperinsulinemia, however you want to term it, the problem is that we can't get that sugar into the cell because we say that for some reason the insulin isn't working. Now here's the beauty of an exercising muscle. The exercising muscle does not need insulin to bring sugar in. It'll just go out there and just sap the sugar up. So that's one of the ways that it improves insulin sensitivity. Because remember, insulin sensitivity says that your body is not responding for some reason to the insulin that it has on board. And with exercising muscle, the muscle doesn't care. It just says, I need energy, and there's some energy out there. There's some sugar floating around in the blood. I'm going to get it, and it goes out, sucks it in, and begins using it, regardless of the insulin. And so now the insulin that's in the blood, in the body, is available to do something else. That allows your body to use a smaller amount of insulin. It allows you to have to take a smaller amount of insulin, so you don't have to take as much. That is improved insulin sensitivity. So exercise improves insulin sensitivity. So when we talk about exercise, a big concept, make it simple. Make it simple. So if you're sitting down and you're planning that next week you're going to go down to the gym and you're going to join the gym and you're going to go Monday, Wednesday, Friday, and then on Tuesday afternoons and on the way to work, and your brain is saying to yourself, no, we don't want to do that. That's not where we're heading. So make it simple. Get out of the house, walk down the street. Boom, done. Right? Get out of the house and walk down the street. Now, once you are doing that consistently and you're doing that for a while and you find that, hey, I can do this and I'm good and I'm able and I'm enjoying it, now go join the gym. Right? Make it simple. Make it consistent. Make it consistent. The simplest way to make it consistent is to make it a daily thing. I talked to a lady several years ago, and I told her every day at 5 o'clock, and that was the time that she had available. Every day at 5 o'clock, I want you to get up and I want you to go stand by the door. And she said, "What do you mean? What I do?" I said, "Just go stand there. At 5 o'clock, go stand by the door. And when you can go stand by the door consistently, then open the door and walk down the street. Every day, that's it. I don't need you to do anything else." Right? Because the consistency that she was setting up in knowing that at 5 o'clock, that's when I go exercise. At 5 o'clock, that's when my body and my mind is ready to do the things I want to do. Right? The consistency set up those routines, set up that habit so that she was able now to say, okay, at 5 o'clock, there's nothing else I'm planning. Right? And she didn't have to think, oh my God, now I got to get in my car and drive down to the street and go to the gym. No, just go to the door, open the door, walk down the street. Make it simple, make it consistent, and make it fun. Now, I remember when I, years ago, decided I was going to start walking on our, we had a treadmill here in the house, and that's a whole nother story. I got to tell you that story sometime. So we had the treadmill here at the house, and so I hadn't been on the treadmill for a while. I hadn't been walking, I hadn't been doing anything. I decided I was going to do it, and I got on that treadmill and I walked for an hour and 45 minutes. Yep, just 1 hour and 45 minutes. Right, because I was doing something for my health, right? I was doing it, I was hitting it, I was going in, and you know what? For the next 3-4 days, I was in so much pain that every time I thought about getting back on the treadmill, my brain was like, no, we're not doing that anymore. Right? So make it fun and make it so that your body and your mind says, hey, yeah, let's do that again. Find something you like to do. Like one of the things that I would love to be able to do, and not that I can't do it, but I have not done it, is I play racquetball. I play handball. I grew up in New York, Brooklyn. That's what we did. Right? And I haven't done that in a while, right? I've tried to incorporate other things in, going to the gym and walking and so, and that's good. And I do that. But if I had a racquetball or somebody here I would play with, I bet I would play more or go more, right? So make it simple, make it consistent, and make it fun. So as again, we're talking about our acronym, DAMSIC: diet, activity, medication, sleep, inflammation, and cortisol effects. And so medication. And here's an interesting conversation to have. So all medication, the goal of all medication is to get your body to bring the blood sugar to the level where the amount of insulin that's in your body is working. And that's whether insulin is coming from outside or whether your body is making the insulin. The goal is to get the two on the same level, because once your body is able to process the sugar, then the sugar is normalized. So every medication that you have, every medication you can ever take, that's the goal. If I'm giving you insulin, I'm trying to bring the insulin up to the level of sugar. If I'm giving you medication that's making your body make insulin, I'm trying to bring the insulin up to the level of sugar. If I'm giving you medication that's pushing sugar out or somehow decreasing the amount of sugar that your body is producing, what I'm doing is I'm bringing the blood sugar down to the level to where the insulin is. Notice everything that we're doing. There's a medication that decreases the absorption of sugar, and the goal there is to bring the blood sugar down. Right? So whenever we're talking about diabetes medications, that is the goal. Now, there are other medications that we currently use, and you guys may have heard and know and use, right, that are giving us the side effect of weight loss and weight management. Right, is a side effect, right? And that's a whole other conversation, which we'll mention here in just a little while. But the goal of diabetes medication, the treatment of diabetes, is to get a match between blood sugar and insulin. That's it, okay? And so when we talk about medication, right, there's several medications, right? Insulin, like we said, we are giving you enough to bring the insulin up to match the blood sugar. Metformin does lots of different things. One of the things it does is it decreases the production of sugar in the liver, and then it helps your muscles to use the sugar more effectively, right? So it hits it on two places. First, it decreases how much sugar comes out of the liver, and then it makes the muscles pull sugar up. So that, in that case, metformin's job is to decrease sugar overall, right? There's some other things it does, but that's the main thing. The GLP-1 agonists, right? These are those medications that I just talked about that give you a side effect of weight. So they do four things. One, they decrease the transit time, they increase the transit time of food. In other words, it slows the food as it moves through your stomach, so people feel fuller longer, so they don't eat as much. Boom, there you go. Number two, it decreases the sugar that comes out of the liver, decreasing sugar. Number three, it improves the production of insulin in your body. So if your pancreas is able to make sugar, it makes your pancreas make sugar. So it's bringing the insulin up to match the sugar. And then it helps your muscles to use sugar more effectively. Okay? So it stops us from putting more in, so decreases hunger. It decreases the sugar from the liver and makes the body use up the muscles, use up the sugar more effectively, so it's lowering sugar. And then if your body can make insulin, it make insulin, so it brings it up. So it hits it in several different areas. The SGLT2s, right, those are things like, well, I'm not going to call the names, but you've seen them on, seen them around, and all they do is they take sugar and they put it in the urine. So basically what we're doing was decreasing sugar so it matches insulin. Notice that. So all the medications, that's their job, is to balance. So that if you have the right combinations of medications, then we get better blood sugars. And I want to say, right, all medications, if you're type 2 diabetic, I want to convince you that medications are simply a Band-Aid. I love medications. I use medications. I could not do my job without medications, but they are Band-Aids. And the goal for Band-Aids, when you put a Band-Aid on something, the goal is not that the Band-Aid stays. The goal is at some point, the thing that's under the Band-Aid, the cut, the scrape, the whatever, it improves, and so now we take the Band-Aid off. And so as I say to you, my goal is always, how do we, the minimum amount of medication for the best blood sugar we can get. And the ultimate of that is reversing diabetes. Okay? So diet, activity, medication, sleep, inflammation, and cortisol effects. So let's go ahead and let's talk about sleep. Sleep. Sleep is one of those important ones because it helps with insulin resistance. It improves insulin resistance. Sleep is so important. You know, they say, right, when they did studies, that someone who doesn't get an appropriate amount of sleep is just as it is just as a bigger issue as someone who is actually intoxicated. Right. So the decision making capacity decreases. Their reaction time decreases. So all of those things. And their body becomes more insulin resistant. It is during sleep that the body rejuvenates, replenishes. It is during sleep that hormones are regulated. It is during sleep that your mind incorporates a lot of the things that went on during the day. It is during sleep, for instance, that the body produces testosterone for men. It is during sleep that we go into that deep REM sleep, we get that relaxation, that our enzymes and our hormones begin to get regulated. And when we don't sleep well, that is dysregulated, right? So our hunger hormones, ghrelin and leptin, insulin, all of those are disrupted if we're not sleeping well. And so sleep is very important. It increases insulin resistance if we're not sleeping well. It increases appetite, right? Because I just told you that it dysregulates our hunger hormones, ghrelin and leptin, or hunger and satiety hormones. So ghrelin is hunger, leptin is satiety. So it dysregulates those so that you wake up and you're hungrier. Just because. Right? You're eating, but you're not feeling full. Just because you didn't get enough sleep. And as a result, we have increased weight, right? And weight actually can be independent of the food. So we are hungrier. We do have more insulin resistance, but we're also putting on weight. It's independent on the fact that you ate something. And so when we talk about sleep, we want to talk about good sleep hygiene. Consistent, regular, going to bed at the same time. Right? Find a time that's convenient and plan your day, plan your life so that at that time you're going to bed consistently. Now, I know that's something I've got to work on, right? A lot of us have got to work on that. And the goal is to get at least 7 hours of sleep. A lot of us need more, but minimum of 7 hours. So minimum of 7 hours, plan to go to bed around the same time, okay? When you go to bed, don't do anything in the bed. Don't be sitting and watching TV and reading. If you need to talk, talk before you get in bed. You and your significant other. Don't scroll on the phone. Turn the lights off. Don't let, lights be popping in and you got the screen on and the phone and no. That's not what we want. So quiet, dark. If you're in bed for more than 20 minutes, or 20 minutes, I should say more. If you're in bed 20 minutes and you have not gone to sleep, get out of the bed, do something else until you're sleepy again, and then get back in the bed. So practice good sleep hygiene. Okay? So it increases insulin resistance. It stimulates the appetite so you're hungrier. It increases the weight, and then to deal with it, we want to get good sleep hygiene. Once again, we're talking about our damn sick diet, activity, medication, sleep, inflammation, and cortisol effects. So inflammation. So inflammation, once again, so a lot of things increase insulin resistance. In other words, a lot of things that happen in our bodies, whether it's sleep or inflammation or some of the foods, it causes the body not to be able to use the insulin that it has on board as easily and as readily. And so inflammation, this has to do either with our diet. So some foods are pro-inflammatory. For example, some people have issues with milk. Some people have issues, and right here, let me make a distinction between an allergy and an intolerance. So an allergy is you eat something, and we're talking about foods here. You eat something and you immediately know, right? Your eyes are swollen, your lips are swollen, you may have difficulty breathing, you may have anaphylaxis. So people who have peanut allergies, that happens. People who have wheat allergy, not intolerance, but a wheat allergy, that happens. It's kind of like a bee sting, right? As soon as that happens, you know if you're allergic to bee stings. So that's an allergy, immediate. An intolerance is something that happens in the body as a result of the food that you ate. And it may be days, weeks or months later that you see the effects. You just don't feel that well. You get a new rash. You get some disruptions in your stomach, in your GI tract. You feel a little nauseated. You feel lightheaded. You maybe feel some headaches. And often it's difficult for people to kind of think back that far to say, okay, what happened? Because they're thinking, well, you know, the last week, the last month, I haven't eaten anything differently. But it wasn't last week or last month. Maybe it was 2 months ago. But for each of us, there are foods that we eat that are pro-inflammatory. Often people will have to avoid, for instance, nightshade plants, which are those, you know, tomatoes and eggplant and squash and so forth. Right? Some people need to avoid soy. Yeah. So if you're having issues, then the goal is to try to figure out what that is, right? Because when you have inflammation in the body produces certain cells, inflammatory cells, and those inflammatory cells make it difficult for insulin to work, right? So remember, insulin is the issue, and as a result of insulin, then we have high blood sugars. So anything that disrupts insulin, inflammation in this case, then that will cause a problem for the body in terms of blood sugars, right? So inflammatory. So people who have autoimmune diseases like rheumatoid arthritis, lupus, right? Behçet's, people who have good pastures or alopecia, all of those are inflammatory diseases. So being able to treat those, very good. So medication, so food, right? Our lifestyle sometimes will cause inflammation, right? So staying up late is pro-inflammatory. Certain diseases, I mentioned the autoimmune diseases, but diabetes itself is pro-inflammatory. It causes inflammation in the body. So being able to manage all those, right, medical conditions, right? So inflammation is detrimental to diabetes, detrimental to obesity and metabolic syndrome because it causes inflammation, and inflammation causes insulin resistance, and insulin resistance is the key. And insulin resistance, I know some people don't like that phrase, but the idea with high insulin resistance is that somehow the blood sugars aren't being improved with the insulin that we have, right? The theory behind it and the actual mechanisms, a lot of people differ or disagree on how that happens, but that's the basic idea. That for some reason my body's insulin isn't working the way it should. Whether the insulin isn't working or there's something abnormal in the cells or the blood sugars are too high, whatever it is, right? The common pathway is this insulin resistance or hyperinsulinemia, as we talk about. Okay. So damn sick, diet, activity, medication, sleep, inflammation, and cortisol effects. Now cortisol effects, this is a big one. All right. I tell the story about this book that I read, and it's called Why Zebras Don't Have Ulcers. Why Zebras Don't Have Ulcers. And the idea behind the book is that a zebra who's out in the wild is being chased by some predator, right? Lion, tiger, whatever it is. And either one of two things is going to happen. Either the zebra is going to get away, or the predator is going to get the zebra. Okay? So if the predator if the lion captures the zebra, then the zebra is done for, right? He becomes lion food, gone. So the zebra is not worrying at that point. If the lion doesn't catch the zebra gets away. And there's an interesting thing about zebras and animals. The zebra got away, and it's no longer thinking, I wonder if that lion is hanging around the corner. Or tomorrow, as that zebra is walking by where the lion chased it, it's not thinking, man, yesterday, this is the same place that the lion chased me. This is where they got George last week. Right? It's out of the zebra's mind. But as humans, we are in a constant state of anxiety, constant state of stress, Many of us, I shouldn't say all of us. Okay? So we live in that tonic place where if we were the zebra, right, we would be thinking, man, yeah, look at this. This is the same corner where I got chased yesterday. Man, you know, if I don't be careful, that lion is going to get me today, right? So we're constantly there. And so zebras don't get ulcers because either they're lion food or they got away. But we're not like that. So just like the anxiety that comes from the chasing of the lion, right? There's this idea called fight or flight. Fight or flight. And fight or flight says that there's something going on, some danger, and I need to get ready to do something. Either I'm running, flight, that's what flight is, or I'm fighting. And actually there's a third one that I want to throw in, and it's called freeze. We either fight, flight, or freeze. We don't talk about freeze often, but freeze is a huge one for a lot of us, right? Because a lot of times when we get anxious, we don't do anything. We don't run and we don't fight, but we just kind of freeze. It's like we don't know what to do. Okay, fight, flight, or freeze. And when we are in the stress response, there is a hormone, several hormones, but two that I want to talk about, cortisol and epinephrine. Cortisol comes out, and cortisol's job is to go find energy. And epinephrine's job is to get the body ready to use the energy. So I got to run from a tiger. So I need energy. So my cells are now set up to use energy, become efficient at using it. So that's what epinephrine does. And then cortisol goes out and finds the energy for me. And the energy in the body is called sugar. So cortisol goes out and finds sugar and gives it to the cell, the cells that are now ready because epinephrine has prepped the cell to use that energy. So that's the process. So anything that causes the fight or flight or freeze response will cause those hormones to come out, and the hormones do their job. They go find energy, sugar, cortisol, and they get the body ready to use the energy, epinephrine. Okay, so that's it. So things like anxiety and stress. Anxiety is thinking of the future, and stress is something that's going on right now, so present. And then depression is thinking about the past. So I'm depressed about what happened, I'm anxious about what's going to happen, and I'm stressed about what's going on right now. So any of those three will cause the body to go into fight, flight, or freeze. And hence, cortisol goes out and finds sugar, blood sugar goes up, epinephrine gets the body ready to use it. So managing all the effects of cortisol helps to improve insulin resistance, and it helps to improve blood sugar, and it helps to, once again, remember I told you, everything that we do when we're dealing with diabetes is with the intention of either raising insulin or decreasing sugar so that they match each other. So if we're dealing with the stress response and we're dealing with all those issues, then we are improving the process, right? So we're decreasing sugar, we're making the body more sensitive to insulin. So how do we do that? How do we do that? And there are lots of things that we can talk about, but just a few. Mindfulness. Mindfulness says that right now I am in the process of feeling where I am, and I'm dealing with this issue right now. I know where I am. I know how I'm feeling. I'm not thinking about the past. I'm not anticipating the future. But right now, at this moment, is where I am. So mindfulness, being mindful, being here, being present. I often talk about the book, The Power of Now. I love the book. If you've not read it, and I have no affiliation with the author, I don't even know them, but I love it. It has made a big change in my life. So mindfulness. Deep breathing exercises, right? And you've probably seen the movies where, you know, somebody's learning some martial arts or some other thing. They're anxious, they're depressed, and they go to a master, and the master says, hey, let's work on breathing. Because if you can control your breath, right? Many things improve, right? Because you've got control. You can deal with the oxygen that comes in. And by controlling your breath, you can actually slow your heart rate. right? Because sometimes if the heart's going, it makes you feel anxious. But if you can slow that down, well, even as I'm doing that right now, it feels good. Okay, slow the heart rate. So deep breathing. Also CBT, seeing a therapist, seeing someone who can sit with you. It's called cognitive behavioral therapy. Right? So where they delve into helping you being able to manage those things that are going on. Right? Emotional intelligence is another one that I don't have there, but that's a great one. Right? The emotional intelligence is the ability to know where you are emotionally, sense the emotions of others, and use that for your benefit. Emotional intelligence. Relaxation techniques, beautiful, goes along with the breathing. Support networks. And now you know I'm a big proponent of that, right? So one of the things that we do on our channel, in my group, in my the things that I do, is we say we educate, we empower, and we encourage. And the encouragement part comes from the community. If you want to go somewhere, go by yourself. But if you want to go a long way, far away, take somebody with you. That is community. And community is sometimes underrated. We have, in our society, become very fragmented. In other words, we've got a family, and then the family, everybody grows up, and they kind of branch off and they go to different places. One is living in California, one is living in Texas, one is living in Canada, one other one is overseas somewhere, one is living in the Midwest. Now, there's 6 kids in my family, so that's why I kind of went through that. Now, they're not living all in those different places, but you get the idea. But the family unit was the community. But we've fragmented that. And so now we've got to create communities, which is not bad, but you got to create them. If you're not careful, you can find yourself in isolation. Create community. Support networks. And then get professional help. If you need it, get the help you need. There's no shame in needing to talk to someone. I know when I talk to my therapist, I'm excited because, hey, I have a space where I can go and deal with issues. Right? You may have a coach, great, same place. You may talk to a pastor, but get someone outside of yourself and outside of your family, right, that can help you deal with the issues that are top of mind. Right? So again, once again, damn sick, diet, activity, medication, sleep, inflammation, and cortisol effects. Those are the things that will help as you're processing diabetes, as you're processing blood sugars, as you're processing even metabolic diseases, right? This is a framework that you can use to begin thinking about those things so that you are not just shooting in the dark. It's not just this nebulous thing that you're thinking about. It is very practical, very usable, and you can now begin saying, okay, how am I doing in each of these areas? And as you improve, if you make improvement in those, then things get better. All right? Awesome, awesome. All right, so what do you think? What do you think? And you guys have been listening. What do you think my ketones are going to be? Why don't we hop over and let's take a look at that right now. And I've got my ketone meter, right? So we're 32 hours, 33 hours probably. I got my ketone meter there. And let's go ahead and I've got to pull up my Keto Mojo app. Let's grab that because I think it's down here. There we go. My Keto Mojo app. Let's get this guy out. And I've got to turn that on. And then we should see it syncing there in just a minute. Awesome. All right. And let's see, what do you think? Boom. Okay, so 103 was my blood sugar, and then 0.4. Okay, 0.4 with my ketones. Remember, ketones that are less than 0.5 are considered therapeutic. Sorry, considered normal. 0.5 to 1.5 considered nutritional ketosis. And then 1.5, above 1.5 is considered therapeutic ketosis. Okay, so right now at 30, what did we say, 32 hours, right? I'm 0.4. Remember, glycogen goes away right at about 24 to 36 hours in that area, right? So right now I'm still 0.4, and so we'll see what that is as we get further into the fast. Okay. All right. And then I want to talk to you a little bit about being unlimited, the unlimited potential that you have to be successful, right? At your fingertips are well, let me say it a little differently. At your fingertips, you have access to unlimited power, to unlimited ability, to unlimited results. You can be different. You can make changes in your metabolic health. You can make changes in your community. We educate, we empower, and we encourage here because that is the platform. That's how we do what we do. With education, empowerment, and encouragement, you have within you the potential for creating your destiny. As I always say, hey, I love being here in this space with you. I love the community that we are developing, that we are growing. I love to be able to come and share and teach and learn. As I said, this is Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level. And in this year, new you. All right, we'll see you later. Bye-bye.